Hello and welcome. Today, we're talking about a medication that plays a crucial role in heart health and stroke prevention, Clopidogrel. You may have heard of its brand name, Plavix, but whether brand name or generic, its primary function remains the same, helping millions of people prevent dangerous blood clots that can lead to heart attacks or strokes. So how does it work, and how can it be used safely? Let's explore everything you need to know about Clopidogrel. Let's start by understanding blood clot formation. Normally, blood clots help stop bleeding when the body is injured. However, in some cases, clots can form inside blood vessels, blocking circulation and leading to serious complications like heart attacks, strokes, or clot-related conditions. Preventing unnecessary clot formation is key for people with heart disease, recent strokes, or those who have undergone certain medical procedures. Clopidogrel belongs to a class of medications called antiplatelet drugs, which help prevent platelets, small blood cells responsible for clotting, from sticking together excessively. By keeping blood flow smooth, Clopidogrel reduces the risk of harmful clots forming in arteries, protecting against cardiovascular events. So, how does Clopidogrel work inside the body? Platelets naturally circulate in the bloodstream and become activated when an injury occurs, binding together to create clots. Clopidogrel blocks specific platelet receptors, preventing them from clumping together unnecessarily and reducing the likelihood of a clot forming inside arteries. This effect is especially important for people at risk of heart attacks or strokes. Clopidogrel is typically taken once a day with or without food, at the same time each day to maintain consistency. Doctors often prescribe it to people who have experienced a heart attack, stroke, or have certain heart conditions, such as atrial fibrillation or after stent placement. Since Clopidogrel affects clotting ability, stopping it suddenly without medical advice can increase the risk of complications. One common misconception is that Clopidogrel immediately breaks apart existing clots. However, it primarily prevents new clots from forming and does not dissolve already present ones. That's why patients at risk of clot-related conditions often take it long-term under doctor supervision. What about side effects? Most people tolerate Clopidogrel well, but some may experience mild bruising, bleeding gums, or stomach discomfort. Rare but serious side effects, such as unusual or prolonged bleeding, severe allergic reactions, or sudden weakness, should be reported to a doctor immediately. If symptoms feel unusual or concerning, checking in with a healthcare provider is recommended. Clopidogrel can also interact with other medications, including certain blood thinners, pain relievers, like NSAIDs, and stomach acid reducers, which may affect its effectiveness. Alcohol consumption may also increase bleeding risk. If you're taking other treatments, consulting with a doctor or pharmacist about potential interactions is important. To wrap things up, Clopidogrel is a widely used and effective medication for preventing harmful blood clots, reducing the risk of heart attacks and strokes. It works by preventing platelets from clumping together, ensuring better blood circulation. However, taking it correctly, following a healthcare provider's recommendations, and monitoring bleeding risks ensures safe and effective heart health management. Thanks for listening, and take care of your heart. This video is for informational purposes only and does not substitute professional medical advice. Always consult a qualified healthcare provider for personalized recommendations.